Endocrine system is a collection of glands which produce the hormones, and these hormones would regulate the body metabolism, the growth and development, as well as tissue functions. So where are these glands? They are the pituitary gland in the brain, the thyroid glands in the neck, as well as the parathyroid gland behind the thyroid, the pancreas gland in the abdomen, adrenal glands above the kidneys, as well as the reproductive glands such as the ovaries, as well as testicles, again in the pelvis. So when the hormones levels are either too high or too low, this will indicate a problem with the endocrine system, and these abnormalities can result in various common problems like diabetes, thyroid disorders, obesity, and sexual dysfunction. And there are various factors that can affect the function of these hormones, for example, stress, infection, sudden weight changes. And sometimes the body hormones can also be dysfunctional in the sense that they don't respond to these hormones appropriately. So for diabetes, you may present with sudden weight loss, feeling very thirsty, and sometimes passing excessive amount of urine. However, there are many people who with diabetes can also have no symptoms, so you need to have a simple blood test to find out if you have diabetes. For thyroid, we can broadly categorize them into three types. First is the hyperthyroidism or overactive thyroid. Then you may have sudden weight loss, hand tremor, excessive sweating, feeling very hot. For hypothyroidism or underactive thyroid, you may have the opposite symptoms like weight gain, feeling very tired, cold, constipated, hair loss. And the last category is the neck swelling, or we call goiter. And for these, again, we have to do tests to find out these growth can be left alone. For example, if they're benign, or if they're cancerous, then they need to be operated and removed. And for obesity, and we define obesity by the body mass index of above 30 kg per meter square. And obesity is a very serious health condition because it can lead to various problems like diabetes, high blood pressure, cholesterol, heart disease, weight-bearing joint problems like your knee pain, hip pain, as well as obstructive sleep apnea, where you snore and you feel very tired during the day. So to treat the endocrine disorders, it requires adjusting and stabilizing the hormonal levels, and this can be done either by medications or if a tumor is involved, then by removing this tumor. And to manage the endocrine disorder, it requires a very careful and personalized approach, because everyone's problems in terms of their hormonal disturbance is different. So endocrinologists are doctors who specialize in managing hormonal disturbance or disorders. So the common conditions which we manage are diabetes, thyroid disorders, adrenal problems, obesity, sexual dysfunction, and many other hormonal problems. So if you have any of these conditions, please consider consulting an endocrinologist.